All right, so this is Chapter 2, Workforce Safety and Wellness. I'm also a walk person, so I'm going to walk throughout this, if that's okay with you guys. The first part of these chapters always talks about like kind of what we're going to go over. It's just like any other presentation from a publisher or anything I'm sure that you guys have been exposed to. Some of the things we'll talk about are infectious disease exposure, and then some of the like safety and well-being things. That's really what this whole lecture is about, is safety and well-being of first responders. And just making people kind of aware of the things that we encounter and also some of the risks associated with the job. Again, it might seem kind of strange to bring this up on your guys' day one, but again, I kind of wish someone would have had these conversations with me, especially with like the dealing with death and dying, stress management, like that kind of stuff, right? I am obviously not a counselor, but I am a longtime first responder, and I have my own things that I've gone through that I'll share some of with you guys. Especially regarding, you know, like PTSD and stuff like that, because that's kind of what we're talking about today. So when we talk about anything in medicine, what do they say is like the first rule? It's do no harm, right? That's the whole point. Do no harm. That's the oath that we take. And that conversation I had with you guys at the beginning when I was like, hey, you know, like you're here to take care of people. You're here to like be a medical provider and have that be your role. You're not here to like judge people and stuff like that. That's the point. Do no harm, right? It's not just talking about medical harm. It's talking also about like emotional harm, inflicting like medical trauma, stuff like that, right? Do no harm is the whole point. It is very important though, and this is kind of something we're getting better at, taking care of ourselves, right? Do no harm to yourself as well, is kind of how I look at it. This job, while it is, in my opinion, that it would be the best job if we didn't have to write charts. Everything in healthcare would be better if we didn't have to write charts. And you'll hear a lot of people say that. They'd be like, this is the best job in the world if you didn't have to write charts. I do think this is the best job in the world. However, there are a ton of things that come up, right? As far as like personal issues that you might encounter, man-made threats, you know, you're going into people's homes. You're going into literally any situation is fair game for us. You have to accept that there's a certain degree of hypervigilance that you're going to have. I'm sure the police officer can appreciate that. That's a hard thing. It changes you, right? It really does. Being aware all the time changes you. And that's one of the big things that you'll hear me talk about is hypervigilance. Hypervigilance is a beast. It really is. Trying to combat that can be very difficult sometimes. Some of this stuff you guys will, if you did like a high school health class, is probably going to ring a bell. Okay, it's like nutrition. Here's like what health looks like. I do think health, like this line right here, is a complex interaction between physical, mental, and emotional need or connections. I would also factor in like spiritual, right? So there's all kinds of different views of health. Someone might be spiritually poor or unhealthy, but be like physically healthy. Right? It just depends on the person. That doesn't mean that because, you know, one person is fairly consistent in all areas that they're not still struggling. I think if you think about health like this as a complex interaction between physical, mental, and emotional connections, your patients will make a lot more sense to you. If you consider that for your patients as well, not just yourself. A lot of your patients are looking for things like counseling. Right? And when I say counseling, I mean not like, you know, talk therapy. I'm saying sometimes they just need someone to tell them it's okay to take Tylenol. You know, like that kind of stuff. So it extends between you and your patients, right? If you acknowledge that health up here in your head, spiritual, emotional, mental, whatever, you know, all of that, it affects a lot of things. And if you've ever had a psychiatric illness or something like that that manifested as something else, like some kind of illness, maybe you got sick a lot, you know, maybe you developed some weird symptom or whatever. It's because health is not just your body. Health is your brain too. Anything chronic physical stress, chronic fatigue, emotional stress, whatever is going to affect that. You guys all know that. This is one thing I do think is important to emphasize though, eustress versus distress. Have you guys heard of eustress? I heard it in my high school health class. And that was when actually a really important conversation because eustress versus distress, a lot of people don't realize there's good and bad stress, right? Like right now I might be stressed because I have my trip coming up, right? And I'm stressed about like, okay, I have to get my visa. I have to do all this. That's a good stress, right? That's a good stress because I have something that I'm working towards and that stress is helping me achieve that goal. That's fine. Finding the balance though is being able to recognize where eustress and distress come together, right? So like I'm in a bit of distress right now when it comes to my trip because I'm also flying, right? We all know what's been going on with the air system, right? That stresses me out. That is distress because that's a threat to me, right? That's a threat to my well-being. You can have the two interface. You can have two of their, like, these things be present in a situation. Absolutely. It's figuring out which one is stressful, like distressing, and which one is actually beneficial to you, like towards your goals or whatever. Does that make sense? Figuring that out, actually being able to say, like, this is a good stress that it's okay to be upset about, changed a lot for me. And it's picking your battles in a sense, right? Resilience. You guys know, the word resilience? It's kind of a buzzword right now. Resilience is so important. There's the ladies' bathroom right over here, just so you know. That's what you're hearing is someone's getting paper towels. Resilience is a big word for a lot of reasons. And I think resilience, the word, just kind of encapsulated what we've been trying to tell people for a long time. Resilience is having a lot of fortitude, right? Resilience means you can have things come your way and you can tolerate it. Coping skills, things like that, right? Someone who's a resilient person is one of those people who, what was that movie about the Olympian who was a POW? Do you know what I'm talking about? He went to the Olympics. Unbreakable, yeah. Like that movie, that dude is about as resilient as it gets. Like if you saw his, you looked it up in the dictionary, his picture could be next to it, right? Because he was able to cope with all the he had his own stuff he dealt with, but he pushed through, he persevered. That's what resilience is. A lot of people don't realize, though, that resilience requires good habits. It's not just people who can be like, I can handle anything, right? It's people who say, I can handle anything because I have the skills to do it, right? It's not just accepting all of that comes your way. So resilience is much more than just being tolerant, okay? Resilience is accepting and tolerating what's happening and then being able to process it. You'll hear resilience come up, especially with first responders, over and over, but in mental health in general, because resilience is part of what makes someone a more mentally stable person. When I say stable, right, I mean like they can handle their emotions, they can interact with people, communicate effectively, things like that. Some things to help with this, though, and you're going to hear this over and over again. Movement is always going to come up, but building habits of mindfulness and positivity, and then building relationships with peers and colleagues, which I already talked to you guys about. But what do you guys know about mindfulness? Mindfulness is your ability to live right now. And it's super valuable. And the reason this came up for me a lot, my counselors, right? One of their phrases, one of their things, mindfulness, resilience, coping skills. You'll hear me say that stuff a lot because it's going to come up in this a ton, right? Resilience factors into mindfulness, right? So if you're able to live right now, it sounds cheesy. That's part of what helps build a resilient person and actually helps combat trauma responses too, right? If you can look at a situation and you can say, you know what, this sucks. This sucks right now, but it's not going to suck forever. That's super important. When you're on a really rough call, one where you're like, choking up, fighting back tears kind of thing, mindfulness is the only thing that got me through. Is being like, this sucks right now, but right now isn't forever, right? Right now equals right now. It doesn't mean the rest of my life. It doesn't have to mean the rest of my life. That's what mindfulness is. I wouldn't consider myself an inherently positive person, if I'm being completely transparent with you. I think I'm a little bit maybe too nihilistic sometimes. Nihilism is basically just, we're all gonna die, right? I appreciate that for a couple of reasons, but I have to really work towards being positive. It's not easy for everybody to be positive. It's really not. Keep that in mind too. Not everyone's going to cope the same way as you, especially when it comes to just being happy positive. I'm not a bubbly person, right? But that doesn't mean that I'm not still okay. It doesn't mean that I can't handle the things that come my way. That's just not who I am, okay? My version of positive is different, and I have to make my version of positive that's relevant to me, right? This is all about you and your experience, okay? So do what's best for you. I'm just kind of pointing out some things that you can do along the way, like practice mindfulness in particular. Strategies to manage stress. You guys know all of these, and I think the comical part of this is the fact that very few of these options are actually feasible for most of your 911 providers, not just EMS in general. We're talking fire and police as well. Minimize or eliminate stressors. Impossible. While you're at work, impossible, right? Some of this stuff is more easily mitigated at home, obviously, but we're kind of talking about on the job more than anything. Change partners to avoid a negative or hostile personality. I do agree with that, but also you're going to work with negative and hostile patients, right? So you're going to have to learn how to deal with that anyways. If you've worked in food service, sales, you're probably going to be fine. People have probably said meaner things to you while you're at the front counter than people do in ambulances. I told people, and I still do, people were meaner. I was an assistant manager at Radio Shack for a bit. I love Radio Shack. People forget it was a place. And people said worse things to me just in my 6 months of being an assistant manager at Radio Shack than they did in the first couple of years of being on an ambulance, which is wild. But that's why I say if you've had exposure to that, like, trying to de-escalate and things like that, you should be okay for the most part. Especially when you're talking about partners that you've had for a long time. It depends on your system you work in. Sometimes you get a partner that sticks with you for a very long time. Did you have a consistent partner on your ambulance?
I did, yes.
Yeah. How long were you guys together?
2 years.
That's a long time. That's a very, very long time, especially if you don't like someone, right? But if it gets bad enough, obviously use your HR or whatever that looks like for you as best you can. Try to work through it though, because these skills are only going to help you. Change work hours. We can't do that. We do 24-hour shifts, right? It depends on where you work. Some places do 12 hours. I've only worked 24s. That's pretty standard. Change the work environment. That's all we do. And that's part of what makes it fun, right? But I do understand what they're saying here. Some people go to like interfacility transfer companies versus 911 versus like flight medicine or something like that maybe caters to them a little bit more. I super support that. But if you're like, working on an ambulance, that's part of the nature of the job. That's part of what makes it so fun. And then cutting back on overtime. We work overtime as a baseline. So where that's going to tie in is maybe you shouldn't pick up mandatory overtime. There's something in the first responder world called mandate or mandatory overtime. Depending on the state you work in, depends on the legal implications of that as to what that looks like. We're a right to work state here in Idaho, so they can't necessarily require us, but if we sign an employment contract that obligates us to those hours, then we're obligated to that, right? So my contract with Ada County, for example, I worked 48 hours a week. And that was my contract. So I got 8 hours of overtime every week. So 16 hours of overtime every pay period. That's what we did, right? And then we changed our schedule to the modified Detroit, and then it increased the hours, right? But that was the contract. So that can only change so much. Other things, change your attitude about the stressor, talk about your feelings, go to counseling. All of that stuff is great advice. However, this last bullet point, I've been telling this people for years. Try to adopt a relaxed philosophical outlook. If you haven't already, find out at least some idea of what your spiritual or religious beliefs are. If you don't have a good foothold on that, it can kind of shake you up a little bit when you're on some of these rough calls. So I did a lot of soul searching when I got into the field, I was 20. I was quite young. I had a decent bit of life experience for other reasons, and that did help me some. But I didn't have like a set religious belief. I grew up in the Catholic Church, so I had that as my background, but I didn't necessarily believe in it, and I struggled a lot. That's nothing with the Catholic Church, right? That's just my personal beliefs. I struggled with it a lot, and then once I finally came to terms with that spiritual religious side of it, it helped a ton. If you're like spiritually confused, this can be a little difficult of a job to get into. So that's just my personal advice to you guys. Maybe do a little bit of soul searching when it comes to that. Figure out what you actually believe in. You don't want to be on a call, with like and sorry, we're going to talk about this stuff as well, but like a dead baby or something like that, for example, and not have the coping skills. And regardless of what you believe, that does play a big role in tying into your coping skills a lot, if you lean on like your faith or something. So just my pro tip, life tip for you, okay? Maybe get a little bit more grounding in that if you don't have it. Expand your social support system. My best friends in the world don't work in EMS. I highly encourage that. I'm sure you're like, yep, it is so important that you have friends outside of this field. Otherwise, you are at work all the time. All the time. You want to talk about it because it's cool, right? like I still find myself doing it when my coworkers show up and, you know, we're just BSing. It's like they tell me about a call and I'm like, that's so cool, you know, and then afterwards I'm like, oh, I need to like calm down, you know, because it just gets spun up again. That's one of the big things. Connecting to the real world, touch some grass, right? That's where your friends come in, right? My best friend in the world works for the Department of Energy. You know, like a paramedic and an energy analyst met and became friends. And it's great because I don't know what she does, truthfully. I know she does a lot, but she also doesn't know what I do. You know, and so it's nice because we can still talk about it, but it's not like me running through calls. So have friends outside of the field. Dating is its own thing. Dating in the field is a very common thing in this field, in this area. And when I say area, I mean medicine in general, but especially first responders. Just consider that, right? The dating world with us is kind of unique. We work very chaotic schedules and all that, and it can definitely also factor in, you know, you go home, you're still at work. So these are all just things to think about, okay? This one also cracks me up. Limit intake of caffeine, alcohol, and tobacco. I don't meet very many people that don't have like religious or like spiritual ideologies that don't support that kind of stuff. Just people who go through life without any of these are impressive. They're like the Chris's. It's amazing to me because most of what you'll find is that the majority of your first responders use something in here. Definitely caffeine to some extent. If anything that's, I don't even want to say abused, but caffeine's pretty heavily abused in the healthcare world. You can't abuse caffeine, I promise. But those are quite common. And we'll talk about substance abuse here in a little bit too. I'm not going to go over nutrition with you. I'm not a nutritionist. The only thing that I can tell you is actually about shift, and it's about your food. Make sure you're bringing enough good food with you on shift, like good food, right? What are you going to fuel your body with? And I hate saying that because it's so corny, but you're working 24 hours. You're working 24 hours. You're going to have to figure out what works for you. I personally abide by a high protein diet, especially when I'm on shift because protein helps with sugar. Right, so when you're on calls, you're running back-to-back calls and your blood sugar starts to tank, which happens all the time. Protein is really good for that. So that's also just a tip for you if you're working long shifts. I don't have my protein shake, but that's a good option for you, right? It'll help carry you through the shift, and it's just good for you, right? It's protein. So that's all I have to add, and it's just because when I was on shift, there were so many calls where it'd be like, oh my gosh, I'm so hungry. I'm so hungry, I'm so thirsty. So like having something like that and actually trying to maximize your food is gonna help a ton. Fiber is a big part of that as well. But again, I'm not here to lecture you guys about nutrition. Exercise and relaxation, obviously the two of them are very closely tied. You can't actually have exercise be good for you unless you relax, right? In order to relax, you need to have some type of activity that kind of sort of wears you out or exercises your body or your mind. You have to have that too, okay? I was always a little, I don't know, I just don't like working out, okay? I don't like working out. I'm tired of the gym dedication culture. I want to be a piece of crap and be horizontal sometimes, you know what I mean? I definitely pushed that, and like the pushback was real for me just because mostly I'm lazy. And when I say lazy, you work 24-hour shifts, right? You just want to hang out. You don't want to do anything. Going for a hike with my dog after a stressful shift in particular really did make a difference. And that's coming from someone who doesn't like working out, okay? The other side of it though is that if you go to work for like the fire service, I believe that a lot of the police departments do this kind of thing too, but they have exercise requirements written into their employment contracts. So like when you're on shift with the fire department, most of them will dedicate an hour to gym time. So they encourage it. It's very important to stay fit in this job for a variety of reasons. If you get hired anywhere, you're gonna have to do a physical fitness test. Just try to stay as like healthy in as many areas as you can. I know that's a blanket statement, but like you don't have to be jacked, right? Like I've done the CPAT before. I did Ada County's hiring physical. I did one for each department I got hired at in general. So I'm a small petite person, right? Maximize your body, but don't push it if you don't have to, right? Not everyone needs to be a bodybuilder. Just try to exercise your body, move. That's really what it comes down to. I don't care what you do. I like yoga. I cannot tell you how many firefighters I turned onto yoga, especially hot yoga, because firefighters are men and men need to stretch, because y'all don't stretch. Y'all know what I'm talking about, but also it's just relaxing, right? It just feels so good. Hot yoga is actually much nicer than people think it is. It's hard, but it's very relaxing. And I ended up getting a whole crew of them together to go to an actual hot yoga studio, and we did a class, and they were like, whoa, that kicked my butt. And I was like, yeah, that's because it's hot yoga, and it will rock your world. But it's awesome. It's a really, really soothing activity, and I like it. So this is one that I find super interesting. You don't have to answer the question if you don't want to, but does anybody feel like they actually get good, like a good, decent sleep most nights? I haven't seen, you have? Or you do? Oh, good for you. You must have excellent sleep hygiene.
Going on screens.
Bingo. Okay. So the reason I ask is because that's the typical response, right? The majority of people are like, not me, right? I still don't. I worked in EMS during like important formative years. I'm pretty sure I did some brain damage to myself by going into EMS when I was so young. But like sleep schedules are still a problem for me. They have been my whole life. But it doesn't help that I was waking up, at whatever hours for a 24-hour shift. That's the big thing, right? And what she just said for sleep hygiene, you'll hear people talk about that a lot. Sleep hygiene practices are super important. And we'll talk about that in a second, but 7 to 9 hours is the recommended amount of sleep. Just as a blanket statement, it changes for women and men. There was a study that just came out that showed that men get 6 to 8 hours and they're pretty good. Women need around 8 to 10. And the thought behind that, from what I understand, is that men's hormone cycles are around 24 hours, women's are around 28 days. So if you wonder why we need more sleep, it's because we are going through a month-long hormone cycle, and it really is exhausting for us. Our bodies are doing a lot of work. So especially for women, this can be kind of hard if you're talking about certain times of the month as well, like in certain parts of your cycle, it can really affect it as well. So 18 hours of no sleep is the same as drunk driving. That was every shift, right? That was every shift for us. So I do think that that's not a healthy standard, obviously, and that's probably one of the reasons that 24-hour shifts won't probably be around forever, you know what I mean? Unless it's like a low volume, maybe more rural system. But in general, those 24-hour shifts, you spend the majority of it awake. The nice thing though is that a lot of agencies, because this says take 20 to 30 minute naps, a lot of agencies encourage safety naps. That's what they're called, because they are safety naps, right? So what's happening at this 20 to 30 minute mark, 20 to 30 minutes is about where you get that energy and the increase in focus. If you're sleeping like 2 to 3 hours, you're paying off a sleep debt. That's not as much for clarity, okay? That's for like you owe that to your body kind of thing. So keep that in mind. As a dedicated sleep person in general, I love to sleep. The 2 to 3 hour naps are not always it, okay? Like the agencies I've worked at, when you were on shift, if you had the opportunity, like our battalion chiefs used to come up to us all the time and be like, you guys should go nap. Why not? Like when you're not on calls, most agencies kind of let you do your thing. Unless you're in the fire service, they might have like a training schedule. We do too, but not quite as relaxed. Ambulances are standardly much more busy than fire engines. So when we get sleep time, we take the sleep time, okay? Engage in mental exercise. Our job, and I had someone bring this up and it was a really good point. They're like, our job is mental exercise. Sure it is. It absolutely is. It's a great mental exercise. You know what is an even better mental exercise? It doesn't require seeing dead people. Learning a new language, right? That's called neuroplasticity. And it's important because when you go through trauma, like we go through, your brain does not get better at its job. It gets better at being traumatized. You know what I mean? So it's not like, oh, I'm becoming desensitized to it. It's like, or you are becoming desensitized to it, but it's not that you're getting better at it. It's that your body is just recognizing it and not letting you feel maybe, or like your brain is, right? The body keeps score. So it's still gonna happen, okay? Do something that is mental exercise, not EMS. I have a lot of coworkers, or had a lot of coworkers that knit. There are a lot of women that I worked with at my old department that knit, and it's hilarious to me because they'll just be sitting there watching TV knitting. And I think that's great. I started learning sign language. I did a little bit of time with like Japanese just to entertain myself, right? Because this job is mental exercise, but it's mental exercise within this box. Okay, you need to be able to open up your actual whole mind for the exercise part of it. Other things like, and remind me of your name again? Taylor. So other things Taylor was alluding to, sleep hygiene, right? Screen time. I keep the blue light filter on my phone all the time. It's never off. Normally on here, I can't tell if it's on it's on my screen at least with the blue light filter for that because screen time is just awful in general. But blue light in particular makes you think that you're awake, so it messes up your circadian rhythm. Definitely important. It's supposed to be a couple of hours before you go to bed. It's not just 20 to 30 minutes, but also getting into a pre-sleep routine. I used to clean up the station every night before I went to bed. So when everybody was asleep, I'd throw my headphones on, I'd go start the dishwasher, run any towels that needed to be run, clean anything that needed it, and then I'd go to sleep. And that made a big difference for me. But I like routine, right? When it comes to stuff like that, that works well for me. I highly encourage that. When you're on shift, you need some degree of normalcy. Even if it's just a couple of little habits that you do them every day. It will help with adjusting to things. You have to have some routine, right? Try not to drink caffeine, obviously. If you can, a lot of the fire stations have blackout curtains, which are awesome. Love those. If not, try to keep it as dark as possible. It plays a big role as well. Exercising is good. Making sure you're hydrated is also important. When we're talking about hydration, it's not just chugging water, right? It's making sure you have electrolytes with it. Water doesn't mean anything if you don't have salt to tell it where to go. Okay, so make sure you're consuming your electrolytes as well. Don't watch the clock. Sleep only when you're actually tired. Bored sleeping is a thing. I do it a lot. It's not restorative usually. It doesn't do much for you in the way of actually like trying to get good sleep. So try to only sleep when you're actually tired. So we'll get into disease prevention a little bit. You'll hear me talk about like fire versus EMS versus police a lot because again, they're very, very different. However, some of the themes remain the same. I think the police force in general, thanks to the FOP especially and like whatever associations they have, a lot of them have like contracts that they basically make with employers for whatever reason. We're talking unions here for the most part, right? When it comes to like disease prevention, health promotion, they're basically saying like that thing I was telling you guys when it comes to working out on shift, right? We want you guys to stay healthy. Here's the things we're going to do for you. Working for Ada County in particular, we had a gym, like an Ada County employee gym it was free. We could go to that. Terrible gym. Not a very good one. But like the other thing too though, right? Like they offer counseling services much of the time. So the employee assistance program is the best. Utilize your EAP, employee assistance program, when you get hired somewhere. It's there for this reason. Okay, the employee assistance programs are there to make your life better. And a lot of, especially if you go to work for like a city or local government, like most of us around here do, they'll have things like this, like things to prevent or things to help with like addiction. Let's say you're an alcoholic and you go to your chief, you're like, hey, I need help. They'll put you through things like this. That's the beauty of having those EAP programs. Utilize them. They're super valuable. Obviously, any type of nicotine is going to have a ton of implications behind it, especially cardiovascular. If you're running into a burning building, you probably don't need to be introducing other things into your lungs, right? Number one killer of firefighters is what? Cancer. Yep. Second is cardiovascular. So for those of you who said that, and it might actually be flipped. I'm pretty sure it's cancer though. Regardless, it's one of those two, cardiovascular or cancer. They don't know about paramedics because we all die and then they don't do autopsies on us. Yeah, I'm just kidding. I don't know why, but firefighters, like a big thing with that is cancer, right? It's usually because of what you're getting exposed to with the chemicals. So in particular, fire departments have a lot of prophylactic programs for like, hey, here's how you can help prevent lung cancer and things like that, right? So the whole point is to just try to help people have a better life as an employee. Alcohol abuse and substance abuse do happen. Again, you probably have a coworker or had a coworker at some point somewhere that was a closet alcoholic or a closet drug user. You might not know, right? But it's also when you get into the field and you develop a partner, or partners that you work with a ton, you're going to get to know them, right? It's actually much more easy to tell an alcoholic, like a closet alcoholic or drug user, when you spend time around them than a lot of people think, right? Especially when you're on shift. So the only reason I bring that up is you're looking out for each other. A big thing in this job is self-medicating. Unfortunately. So when it comes to alcohol abuse, we'll talk about alcohol abuse and substance abuse at length in the medical unit. Just know that alcohol is a known carcinogen. It's one of the only guaranteed carcinogens that we know of for sure. It causes cancer. Alcohol does. We know that, okay? So, I mean, I'm not judging anybody for drinking either. I'm just saying it's a slippery slope. Alcohol is one of the only legal things that people can use, right? When I say legal, I mean we're talking you work for the government. You can only use substances that are legal per the government. So alcohol is a common one. But when it comes to drug use, what you'll find is a lot of people, I don't know very many people who honestly like abuse drugs like what maybe you would encounter on calls, you know, that level. But there are definitely people that maybe have a slippery slope with like their Adderall prescription, right? Or maybe like their pain prescription or something like that. So substance abuse is not just like, oh, you're going and buying heroin from the gas station, right? It's anything that you have a dependency on that you lack control over. So that's important to remember, because especially when you're talking about people who are traumatized in a sense, right? Traumatized people are very vulnerable. And substances feel good, okay? That's where mental health comes in. A big part of mental health. A lot of agencies have programs to help with drug abuse and alcohol abuse and things like that. For what it's worth, I haven't encountered too many people, too many of my coworkers. I do have one coworker that did have an alcohol problem. They went to one of our superiors, talked to them about it. They put them through the program, like a rehab program. They didn't like put them through it, like pay for it, but they helped facilitate it, and they went back to work. So that's what they want, okay? So just be honest with people, especially if it's about something like this and you feel like you can. You don't have to go through it alone. You really don't. And I know it's not that easy, but still, you don't have to. Balance everything. Take vacations when you can. That's basically what that means, right? Even if it's a staycation, get out of the city. Get out of the city. Go to Swan Falls, camp down there, something like that. Go up to Bogus and face the other side. Don't face Boise, right? Face the other side. Face the beautiful green, expansive area back there. Just get out. Don't see this or wherever you work, right? I made a point to do that quite a bit when I worked here because I lived where I worked. And that's a special kind of hell, in particular, especially when you work somewhere for a long time, like I did. Now, infectious and communicable diseases. You guys probably know what communicable diseases are, if you've heard that term. It's just anything that spreads person to person, or from one species to another. It just means it spreads, okay? So we're going to talk about this for the next few slides. As far as immunizations go, it depends like where you go to work. You are going to be required to have immunizations unless you have like I believe it's a religious exemption, is the common one. But for the most part, it's just like any other health field, right? You're going to have to present your immunizations. Pro tip for you guys, just right now, while you're in school, try to find your vaccine records. If you don't have them, get a hold of them, or go get like your boosters, get your titers drawn, whatever it is, locate your immunization records. It can be a massive pain to try and find them last minute. And I know that because I lost my immunization card in my mom's house fire, so I had to go get 6 booster shots in one day. And it was awful. So find them now, okay? Protective techniques and hand washing, that's pretty straightforward. Protective techniques are like, right, coughing into your elbow. Some terminology though, pathogen, contamination, exposure, PPE. Pathogen is something that activates your immune response, right? Your immune system's like, oh, hello, you are here now, and you are a pathogen. That's what that does. It just alerts them. Contamination is when something has had exposure, whatever kind of exposure that means, to a pathogen. And that exposure means you've encountered it, right? Maybe you breathed the same air as someone who coughed into it, or maybe you got blood on you. you had some kind of interaction with that. And the way that you try to prevent that is with PPE or personal protective equipment. I'm a PPE fiend. I love PPE for the most part. I'll tell stories of why that is throughout the class, but cannot support PPE enough. I'm a bit of a dweeb about it, but I like it, and I'll explain why. Different routes include, these will come up in your national registry and on your benchmarks for me quite a bit. So I would encourage you to review this. Or just like at least get comfortable with it. Direct contact would be, let's say you get blood on you, right? An indirect contact is a needle stick, for example. And the reason that's not a direct contact is because you're not encountering it like you do if you get blood on you. The only contact is because of the needle. Otherwise, it wouldn't have made contact, right? So it's indirect by those means. Airborne is like you're sneezing. Foodborne is contaminated food. Vector-borne would be any of your bugs. Fleas, ticks, bed bugs. Bed bugs are a big 911 thing. The little creepy crawlies definitely come up some. I'm sorry to tell you. If anything in this lecture that's probably the most discerning, it might be that. If you ever had a bed bug exposure before, it can be a real pain to try and like decon an area or whatever. So you guys will get a lot of exposure through your agencies that you go to work for, or maybe you have already to this, this information. This is just your PPE, and the CDC gives us these guidelines for, you know, here's the PPE that we offer, or that we have, and not offer, sorry, that we have, and here's when it's ideal to use it, right? When you're putting on your PPE, you are donning it. When you're taking it off, you're doffing it. I don't know why that comes up, but when you hear, when we're talking about putting something on, taking it off, it's donning and doffing. That's like the fire service uses it as well. At least when I was there, there was a lot of the donning your PP or donning your SCBA, doffing your equipment, whatever. However, you take, let's say you're like the COVID getup, right? You've got the surgical mask, the iPro, the gown, all that stuff. There is an order for which you have to take it off. I don't expect you to know that, just be aware. Your agency will put you through an infection control class where they walk through all of this stuff with you guys for how they expect you to maintain their standards. Guarantee they're just going to tell you the same thing because we all follow the CDC, unless they have something in particular that they want you to know. So hand hygiene, this is just washing your hands. Get under your fingernails, right? Make sure you're getting in between your fingers. Use soap. A lot of soaps these days, from what I understand, are made to work with cold water. I don't totally understand how that works, but someone did tell me that. I don't understand it, so I apologize, I can't answer that. Only thing I want to stress on this is that hand sanitizer, you can only use it, I think it's like 2 times in between your hand washing. I think that's what the CDC encourages. So if your hands are soiled, you cannot use hand sanitizer. You gotta wash them. Okay, hand sanitizer doesn't do anything for material or content. Okay, it's just for the viruses and bacteria and whatever else. It doesn't handle puke or poop or blood. All right, gloves. Most of what you're gonna find are nitrile gloves over there. These are, I don't know what these are. These are like cleaner gloves that you buy from Walmart when you clean a really sketchy bathroom, right? That's what these are for. Ours are much more fitted. We do use nitrile, like I said. Latex is pretty much nowhere in healthcare anymore that I'm aware of. It's still in like some places, but it's not a thing that we put that, or not a thing that we expose people to as much as we possibly can, because a lot of people have latex allergies, myself included. It's a very, very common thing. So nitrile is what you'll find. Vinyl gloves are fine. I don't like them, but nitrile again is the standard. You should always at least have gloves. At the very, very, very least, have your gloves. If you go on a call without gloves, that's a little unhinged, okay? And it's quite inappropriate, because how are you gonna help without potentially exposing yourself, right? You should be prepared to help. I don't care how or when you put your gloves on, just have gloves available and have a backup pair. For me personally, my left pocket was my glove pocket, and then my left calf pocket was my large glove pocket. So I kept smalls here so I could just reach in and grab it, and then if I needed to, because either a glove broke or I couldn't put a fresh pair of gloves on because my hands were sweaty, I had a pair of mediums that I would just slip over. I don't encourage that, but when a glove tears on like a trauma patient, like a really bloody one, you have to do what you have to do. So that's at the very, very least gloves. I'm also an eye pro person. The running joke kind of was that I always had a pair of glasses on. I always had my eye pro up here with my sunglasses on. Or did you do the same thing?
I was more your eye pro.
A lot of cops do that I've seen. They do the exact same thing. They'll swap out between their eye pro and then their glasses, like their sunglasses. Glasses, like glasses that you wear, are not rated for PPE. Okay, so if you want, you can get prescription eye pro, but it's expensive. So it is an option. I never did it because I wear contacts. But eye pro is the way to go for me. My reason for that is because you don't know when people are going to cough on you. You don't know when people are going to cough up blood on you or puke on you or whatever, right? Your eyes, nose, mouth, ears are mucous membranes. They're an introduction to the inside of your body. That's how things get to you. Okay, that's why you protect them. So protect your eyes, especially for blood, because we deal with a lot of blood splatter. I would have loved to have a gown during my field delivery that I did, but that wasn't feasible. So gowns are not always ideal for us. If you're on like any of these, a field delivery, major trauma, totally. A gown is cool, but wearing a full gown while you're trying to do things in somebody's house, not like an operating room or something, is quite difficult. So if you have the gowns, great, but they're more for like the super messy stuff. This is a respirator. This is different from an N95 because this actually has the respirator right here. But you guys are probably used to the N95s. This is a pocket mask that a lot of people keep like in their cars and stuff for CPR. This is also, or it's a barrier device so that if you're on you're at Winco or whatever, and for whatever reason you have this on you, if you give breaths to someone, it's a one-way. So this is nice because if they vomit, you all right? Yeah. Just wrong tube? Yeah. This right here is a valve. So if they puke or something and it's coming up through the mask, it's not going to go up because that valve is going to close. So that's just another thing. We don't use these in the field, not that any agency I'm aware of, but this is something you might encounter that people have on, like in their personal vehicles or something like that. It is still a very valuable piece of PPE though. Sharps, if there's a needle, put it in a sharps immediately. Okay, immediately. That should be your rule. I have seen far too many people get needle sticks because they're lazy. Put it in the sharps immediately. I have very, very, very little grace towards people who don't do that. It's why, right? It's a needle. It's a needle. Put it in the sharps right afterwards. So no employer can guarantee a 100% safe environment. I don't think OSHA is aware of first responders or aware of what we actually do because nothing that we do is OSHA compliant. I don't even know where we fall into that kind of thing because like a risk assessment analysis changes with each call, right? You have your risk going to the call, just driving there while you're interacting in the whatever, the home, the grocery store. And then you have the interaction, or then the transport to the hospital. Then you're at the hospital. There's tons of opportunities for things to happen, okay? If you are acting safely and you talk to the people that you need to talk to, like your infection control officer, it's gonna be okay, all right? But you have to talk to them, okay? Especially if you're talking about like workman's comp, things like that. If you get injured, you talk to someone immediately, okay? Immediately. Big sister advice right now, also long-time first responder advice. You get hurt, you stop what you're doing, you call your supervisor. Okay, workman's comp in this job in particular does not obligate you to getting hurt. Okay, I have a shoulder injury that I got while I was at work and it still bugs me. And it's going to continue to bug me forever because now I'm a part of the Hurt Shoulders Club. And humans have terrible shoulders compared to like every other species. Ours are just awful. They have good mobility, but no, like such little structure. Anyways, clean your ambulance. Clean your ambulance like your grandma, your child, your sick best friend, whatever is going to be the next patient in that ambulance. That's how you should view it. Those gurneys, like that one back there, can be pretty much completely taken apart and pressure washed. Clean it. You'll see, you can't see it right now, but it's right next to that plane. I'll grab it another day. But there are these cleaners. They're your purple tops, orange tops, gray tops, whatever. They clean different things. Some are for bacteria, some are for bleach in particular, like for MRSA or C. diff. I believe that's what we use for those. Different cleaners for different things. Follow your infection control plan. Okay, whatever your agency tells you to do, follow it. Clean that ambulance like your loved one could be the next patient, because your loved one could be the next patient, right? As surreal and awful as that is to think about, it could happen. So treat it like that. The nice thing though is that the majority of people that we encounter will have some kind of immunity. And when I say the majority of people, there are populations of people that have their religious exemptions. Some people can't get them because of like an autoimmune disease, like little kids in particular. That's the other reason you clean your ambulance, okay? Not everybody who goes in there has the ability to cope with the things that they might encounter. Like a cancer patient is like MRSA or C. diff. C. diff will wipe out the average person because it's so aggressive. You imagine that like a cancer patient getting that could be a death sentence for them. Okay, so please keep it very clean. These are very vulnerable people, and some of them don't have immunity like the rest of us that got our immunizations do. Keep that in mind. I didn't know there was a chickenpox vaccine for a long time. We had chickenpox parties when I was a kid. You know what I mean? So that was my immunity. We did herd immunity back in the 90s and 2000s by saying, you have chickenpox, all your siblings are going to get chickenpox too. And you're all going to go through it together, which was awful. But these are the common ones you'll encounter: Tdap, MMR, influenza. If you go to work in a hospital, they'll likely, anywhere, they'll likely just pay for it and do it for you, like Ada County does. You don't have to get it most of the time, but it's nice because a lot of people or a lot of agencies just have it, and then they do like a big thing where they just do like a mass vaccine, which is quite handy for us when you're talking about 911 and how inconvenient it is, right? And tuberculosis. If you have not had a TB test, agencies usually require one within 3 months of getting hired. I had to do them pretty consistently because some of the populations I worked with had tuberculosis. This is an N95 at the very least. Okay, I don't care how you guys feel about COVID with PPE. That was a just disaster for a lot of reasons. When I'm talking about PPE, guys, like I'm telling you, these are the things that you need to be doing. This is none of like the political stuff, right? This is, hey, if you go on a TB patient and they cough and you don't have an N95 respirator, you will likely get a TB exposure. Like very, very likely. And TB lives in you for a very long time. It's not worth it, right? Just wear the mask. Is it cute? No. Especially not if you wear it with iPro. Take it from me, because that's how I look, right? It's not about that, right? It's about your safety. Also, you're going home. You're going home. What you have on you, on your person, on your clothes, on your boots when you go home is going to your family now. So keep that in mind as well. If you get exposed to something, I already talked about this, talk to your infection control officer. Whatever they want to do. Again, they usually follow the CDC guidelines. Some agencies have extra things they want to do because it's like, not just maybe an agency thing, but it's a state thing. You know, maybe they require this checkup in 3 months. I had an exposure to an HIV patient, and I had to go get my blood work done. It's like once a month for 6 months. Then it was like once every 6 months, and then it was once a year. And now I'm done. So I don't have to worry about it. But that kind of thing, I had to do it. And even if I didn't work there anymore, they still have to provide that for me because I sustained that exposure at work. So that is nice too, though. They are required to take care of you in that case. So we are going to talk a lot about scene safety, but the big point I want to stress on here, and the officer in the room can absolutely back this, is that we rely on the police for a ton. At least here locally. I'm not sure what you encountered. I relied on the police for a lot of things, and it wasn't like I'm going to call my mom. Sometimes it was like that, right? Because mom being the police officers with the on their side, you know, like that's a little emphatic. It's going to be like, all right, you're not going to listen to me. I'm going to call in my support, and you're definitely probably going to listen to them. Right? I don't like using the police as like leverage or anything like that, but sometimes we kind of have to. Otherwise, their main job is to keep us safe. I cannot begin to tell you how many police officers have gotten in the way of me getting hurt. Like, truly. And it's a very deep, like, I will make fun of the police relentlessly. I pick on them all the time. However, I have a huge soft spot in my heart because a lot of the cops that I know that like did jump in front of me have families. You know, they have kids, they have spouses they go home to, whatever. So police are a big resource, especially here. Also firefighters, you know, and if you're a firefighter, use your ambulance providers, you know, your EMTs, your medics, use us for what we can. We need to use each other, especially recognizing though that the scene, when you're on a scene with your partner, you are no longer just yourself, you are in a partnership. Your partner is an extension of you. You don't do anything that could compromise their safety or your safety, right? You don't leave them alone if you can, right? You don't leave them with questionable patients. If it's a young woman like me, it was Dexton, right? Or Jones. Let's say he, how tall are you?
5'11" to 5'10", depending.
That's taller than me, so I'll take that. Let's say he's super aggressive, he's hopped up on meth or something like that, right? I'm a very vulnerable person on that call because I'm small, I'm probably the only female, and I mean, I'm also just a target. I look different, right? Because I'm a chick in a uniform. Easy for me to be a target, and a lot of people protect me on calls, and I do feel kind of bad for that, but also I protect them, right? If someone swings on one of my officers on scene, or one of my firefighters, you're gonna get sedated if that's appropriate. You don't get to hurt my people. You know, it's that kind of thing. I'm not saying I'm like, oh, you hurt my friends, needle. You know, I'm not saying that, but I'm saying like, it's also my job to protect them, right? And the way I protect them is a little different than how they might protect me, okay? But we look out for each other. And we'll talk about scene hazards a lot. Hazmat is one of them, hazardous materials. I don't mess with that at all. That stuff is scary. I love chemistry, but not this kind of chemistry. We'll go through some of it, like I said, throughout the class, but electricity, who do we call if there's an electrical event? Idaho Power, yeah. So if you call the fire service, they're gonna go, okay, click, hello, Idaho Power, right? Gas lines, anything like that, they call Intermountain. So the fire department in particular isn't just the handyman catch-all. They're just a resource that can actually specify who needs to come to a scene, especially for scene hazards. Obviously, we have people for this. Vehicle crashes, 30% of your in-field deaths, or I shouldn't say 30, yeah, it's the majority. If you die while you're in service, like on duty, most likely because you're at a traffic stop and you get hit. Why? Rubbernecks, right? People want to look at what's going on. First responders get hit all the time. When I say all the time, I don't mean like every day kind of thing, you know, but it's a common occurrence and is one of the things, and is the top thing that kills us. Please be careful on the side of the road. Wear your safety vests, okay? Wear your safety vests. They're not cute either. I'm aware of that, especially if you have eye pro and a mask on, but you should, right? Safety vests are non-negotiable for me. If I had partners or anybody on a scene that wasn't wearing them, I went up and I told them, hey, you need to put your safety vest on. It's also a legal requirement. So we're not going to get too much into the scenes of violence. We'll talk about this throughout the class because there's just too many layers to it. There's a difference with like traumatic brain injuries, right? You can have a combative head injury versus a behavioral subject versus someone who has a severe infection that is now agitated. The big point that I want to get across with violent subjects or violent situations in general is it kind of depends on what you're dealing with. Obviously, we don't have many riots here in Boise. I've worked a number of the protests we have, and I'm talking about Boise here because this is where I live and work, right? But even just in Idaho in general, obviously some of this we're not going to encounter too much. We would love to say we don't have active shooter situations here, but unfortunately we've kind of bridged or crossed that, right? We had our mall shooting a few years ago. Gosh, three years ago, something like that now. Obviously not to the level of a lot of other places, but everything is fair game. We're still, you know, it doesn't matter where you are, all of these things are fair. I don't have much experience with hostage. I did very, very little TAC med, tactical paramedicine, very little bit of it. But again, that's more where you're working with like your sheriff's office, high-risk warrant deliveries, things like that. You might do like tactical paramedicine stuff where you go along with the SWAT team. Otherwise, if you're on a call, assaults are the big one. Mass violence is a potential for sure, but more so that it doesn't talk about as much interactions with people on calls. Family members during the holidays. Yeah, people throw hands on the holidays. And when I say throw hands, I mean like they assault each other quite violently. It's just a thing. I don't get it. My we play board games and then we don't talk to each other, so I'm not saying we're better than anybody, but I've seen a lot of these like family get-togethers during the holidays in particular where it's violent, right? And then you're like, you can appreciate this again, sorry to reference you so much, but having to move people out, right? You have so many people in a scene that are pissed off at each other, right? How do you try to diffuse this situation? That's where it gets hairy to me, is when you have very passionate family members around that are maybe a little heated, stuff like that are maybe don't have the same control that they normally would, like the death of a child or something like that. As far as preventing violence, you're going to have to develop your own skills for that. It is an art form to de-escalate people. I'm a big fan of removing, of just saying, you know what, you go here, we're going to go to timeout for a second. Obviously you don't say that to people, but that's kind of what it is, right? You're going to go here, this person's going to talk to you, you're going to go here, this person's going to talk to you. People do get squirrely, but again, thankfully, police, fire, even I say police and fire as if I'm only referencing ambulances. It's just more so that that's the role they fill in general, as well as a lot of it's safety for us, because again, most of what you do is medical calls. I'm not above giving it to people straight and being like, hey, if you're going to threaten me, this isn't going to go well. This isn't going to go well. If you hurt me, you are a felon. In Idaho, you're a felon automatically. You get a felony, automatically if you hurt a cop or a first responder in general. I'm not above using that. Is it a threat? Yes, but sometimes people need those kinds of things to be like, hey, it's about to get really, really real. I encourage you to listen to me now. Sometimes that is appropriate. Sometimes that is appropriate, okay? I need to emphasize that. You have to pick your battles. And the only way you can do that is by going out into the field, okay? I promise I'm not gonna talk at you for very much longer. This is really only interesting, it's interesting to me because it brings up your cold weather gear and things like that. We talk about SCBAs and other things like safety equipment, aside from our cold weather and warm weather gear. I carried a backpack with me on shift. It had sunblock, couple extra water bottles that had that plastic hot water taste. It was great. But when you're in a pinch, right? When you're in a pinch and you're on a traffic accident on Eagle Road and it's been 2 hours that they're extricating someone, sometimes you just need some water, right? Sunblock, I kept an extra hat, water bottles, liquid IV, hot packs for your hands and that I could put in my boots, a beanie. I kept some non-perishables and.
I do have one for the boots you were mentioning earlier.
Mm-hmm.
Really hot weather, if you buy cheap boots, the heat comes through them.
Mm-hmm.
It starts burning them.
That's actually a good point, because a lot of your boots are going to need to be thicker for safety reasons, like for the fire service in particular, for sharps, like glass and stuff, but also the thermal rating on them for firefighters in particular, right? So that you can walk out into certain areas, like if you're doing wildland. Absolutely. Yeah, good boots is an important part of this. With the cold weather gear and warm weather gear, your boots are pretty good for both of them, but definitely consider purchasing some Gold Bond. Gold Bond goes a long ways with these sweaty boots, okay? You can wear a helmet if you want. I don't encourage it for your standard call. This just isn't very feasible on the average call, I don't think. Firefighters don't usually walk around with their helmets on because it's uncomfortable and they're heavy. If you need to for the call, obviously do it, but you totally don't have to. These gloves, the agencies I worked for gave us gloves, but you can always go find a good pair of outdoor, like hunting gloves is what I usually encourage for people if you're going to be working on the ambulance. Those hunting gloves are intended to get wet. A lot of them have like a wool lining. Wool is where it's at. If you're talking about staying warm, wool socks, you know, they can get wet in particular, but still keep you warm. So big fan of wool. These boots, you'll see this style a ton. I don't recall what the specific brand is, but it has the mid-zip. I see a lot of cops, a lot of firefighters with them. It's just a style I figured I'd bring up.
Those are the Chippewas.
Chippewas, that's what it is. I don't mind them. They're bulky. They're a little too bulky for me. I already mentioned this. Aside from body armor, we did have ballistic vests that we were supposed to fit to us when we got on shift. That is one thing I did every single day that I did not learn in paramedic school, right? We didn't go through that kind of stuff, but once that, or not once, we did it before. Thankfully, we went through here locally some of the ASHER trainings, which is active shooter in hostile environments. We went through some of this stuff with like ballistic vests already, and you're supposed to be fitting it to you at the beginning of each shift so you could throw it on and just strap it on. If you're a big person, this is actually one area that doesn't suit you very well. These ballistic vests are quite small. The plates don't actually cover as much of the area as people think they do. I don't know about you, but one thing I've noticed with a lot of officers is they get this standard size ballistic vests with the plates are like, they're like that big or something, but on like big guys in particular, it would only go to like here, you know, and then they've got the sides of their shoulders and chest exposed. It should be better fitted from what I understand, but also if you're a big dude, you're a big dude. You know, it just might not fit you as well. They happen to fit me very well because they take up the entirety of my chest because I'm a very small person, but not guaranteeing that you'll encounter these for sure. They are expensive, but this is the world you're kind of stepping into with first responders. Unfortunately, it's a world where you have to maybe consider wearing a bulletproof vest. So I've worn them quite a bit. He's got way more experience than I do, but I've worn them quite a bit. I don't have a problem with them. They are deeply uncomfortable, but this is a pro move. Keeping your hands warm in your vest like this. You'll see a lot of cops walk around like that. It is a great armrest, and that's about the only way I feel towards them. So caring for the critically ill and injured patients. A lot of this is going to be my advice to you, okay? So really when it comes down to this, my philosophy is, hi, my name's Kylee, I'm a paramedic. What's going on today? What happened? That kind of thing. Or what's your name, right? My name's Kylee, what's your name, blah, 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 I'm a paramedic, what's going on? Introduce yourself every time. The fact that people don't think we should be introducing ourselves is ridiculous to me. It takes 10 seconds. Also, do you mind if I touch your arm really quick? When I go on a call for a patient, I walk up and I do check a pulse and I say, hi, I'm Kylee, I'm a paramedic, what's going on today? And I just got a ton of information from him. He looked at me when I looked at him, right? I felt his skin, I felt his pulse, I directed a command towards him, right? What's going on today? He looked at me and was about ready to answer it. Just from introducing myself, I got a ton of information on that patient. It's also respectful. Just do it. I would always tell people, hey, that whole spiel, whatever. Let's say they're asking about their condition. I would say, I don't have the imaging and all that stuff that the hospital does. I can't tell you exactly what's going on. I have a pretty good idea, and I have a lot of the same treatments that they do at the hospital. If something comes up, I can treat it. That's what I liked telling people. I'm not promising anything, right? But I can treat anything in some way. Whether I'm recognizing it, passing off that information to the hospital, whatever, I can still recognize it, and that's important, right? Saying, I don't know what's gonna happen. I can't see what's going on in your body, but I can tell you that here's what I do see, X, A, B, C, whatever. I can treat these things. So if something comes up, just tell me what's going on. We'll go from there. That works really well. Don't lie to people. Don't give them false hope. If anything happens to somebody where maybe they witnessed something and they're a bystander, also consider that has the potential to be a patient too, right? I've been on those calls where something happens and we're interacting with the patient, but there's also a bystander who now is having something happen, some kind of distress. So keep that in mind too, right? When I say bystanders, it's usually kind of like a panic attack or something like that. They're not critically ill, maybe, you don't know, right? But they're still experiencing something. Still be nice to them, right? If there's family that you can put people in contact with in particular, it's not as easily accessible for us. The police are much better at that. That was something I really like to do with my officers on scene. I'd be like, hey, you need a task and I need a family member to contact. And they're very good at it. They are very good at finding people. I had an officer come up, I was like, I don't know this kid's name. I don't know anything about them. And the officer went, hold on. And we hadn't even left the scene. We were maybe 5 or 6 minutes later. He walks up with this kid's name, parents' phone numbers, the addresses that they work at. And I was like, dang, you're good.
School resource officers are great for that.
What's that?
School resource officers.
SROs are amazing for that. We'll talk about SROs a little more too, because they play a big role in when we interact, especially on Thursday, when we interact with schools, just in general. So big fan of that. If we're talking about children, I can't give you a recipe for how to talk to people when we're talking about a dead kid. There's no recipe for it. There's really no guaranteed method that's not going to have people be pissed at you. It's an awful situation. If you have some kind of program, we have the TIPS program here. It's like trauma intervention something services. Basically, if I go on a call and I have like a dead child and the family needs a resource, I can request tips, and the people that are trained, they're also volunteers, will go to that call and go help them. They're trained in grief stuff, like, I don't know grief counseling in particular, but grief things. Great resource. The police are also very knowledgeable on local resources for that kind of stuff. Utilize them as well. Fire is definitely not as in tune with like social services and things like that, not nearly as much as the police are. Highly encourage you to utilize them for the social side of our job, especially. The fire department, that's not exactly their forte in most areas. But when it comes to the death of a child in particular, I would definitely reach out to the police and be like, do you guys have any programs? Or maybe consider reaching out to someone in the clergy, right? Depending on where you are or where your patients are with like their religious endeavors, their faith. I don't practice as a Catholic anymore, but for some reason, it would just feel good to me if I was grieving to just have a priest to just talk at, right? Because that's what they do a lot of. That's part of what it means to be like a minister or whatever, you know what I mean? They make it as, well, how do I say this? When we're talking about the clergy in general, they're really just making this a support system. Those are not supposed to substitute for grief counselors and things like that, okay? So you have to think about the downstream effect of things. That's where the police come in. When it comes to delivering death notifications, we'll talk about that a little bit more, but death notifications, we are allowed to do that in the field. Most states allow EMTs, the EMT level licensure, so it goes EMT, advanced EMT, paramedic. You guys would be able to pronounce death in the field here in Idaho. With that, a lot of layers to it. Hospice versus, a sudden death, whatever the situation might be. We'll talk about it as we move through the class, different modes of communication for different types of people. But few things that I do want to mention is this is actually a very real experience that you see people go through within minutes. You'll see people go through all of these stages of grieving, and it's very hard. It's extremely difficult to see people go through this as quickly as they do. I think one thing that helps me in particular when it came to like managing these kinds of scenes would be like, you don't have to talk to me. I'm going to be here regardless. Okay? If you want to talk to me, you want, me to sit next to you, whatever, you tell me and I'll make it work. Right? That it gives them the opportunity to do what they want to do. And I've had really good feedback on it. Sometimes people just want you to sit next to them. They really, really do. I've done that so many times where I'm like, I'm going to be right here, okay? I can't leave them alone much of the time. However, I'm going to be right here. I'm going to give you some privacy, right? If you need me, I'm right here. And I've had a lot of people be like, can you actually just come sit with me? Yeah, totally. Do you want to talk? No? You got it. I have plenty of things that I can go through in my mind while keeping you company. You know what I mean? So I think that works very well. I've had good feedback on it. Let people do what they're going to do. Don't let them hurt you. Don't let them threaten you, but let people do what they're going to do. If things get a little dicey, the police are there to help you out. The police are on every death notification because it is now a crime scene until they've established that it's either not or they do their investigation. So let people do their thing. As long as it doesn't damage the scene or the evidence, the police are pretty willing to let us use the things like use family members. You know, I've seen them let kids get stuffed animals out of bedrooms and things like that, right? Things that comfort. Just get the police involved. They'll help a lot. I don't like any of these. I think these are really awful for the most part. I don't, again, we'll talk more about this as we go through, but in particular, that must be painful for you. Hate these. I hate them. Think about if someone said to you, said some of these things to you, would it feel condescending? Maybe a little diminutive, maybe a little like empty. I think they're a little empty, and that's my biggest beef with them. I kind of pick what I'm going to say based off of the call and how that call is going. If you don't know what to say, don't say anything. You could be doing some serious damage if you're trying to give advice and you're not the person that should be giving advice. For the first bit of your career, listen to your older medics and your old EMTs. Watch how they talk to people. Watch your supervisors. That's normally what they're doing on these calls, is bouncing around, talking to family members and things like that. If you have, like, if it's something that you care strongly about, like I do, go find a 20-year BC or something like that and say, how do you talk people through death? You know, like the family and stuff like that. Talk to them. The only way you can get better is by asking people what works for them. This last thing, alarm fatigue. Have you guys heard of that? Alarm fatigue is when you are exposed to a stimulus repeatedly and you eventually stop responding to it. That's not a good thing. It sounds nice and it would kind of feel nice if it would go away like that, but it doesn't. The problem is you have that stress, it repeatedly comes up and you don't deal with it, and then you don't get to recover from it because it just keeps coming up and you're not dealing with it. That's how people get stuck in the alarm fatigue. Burnout's another thing. Anything that makes you feel hyper aroused or makes you feel like you're running from a saber-toothed tiger, like all of this stuff, is considered the reaction to it, right? Whether it's a trigger emotionally, something physically, whatever, they'll look like they're running from a saber-toothed tiger. And a lot of it has to do with these situations. That alarm fatigue is exacerbated by PTSD significantly, oftentimes because of this. And it's not usually the sights and smells that bother me, it's the sounds. Sounds are a tough one. You'll hear a lot of people reporting, like, you know, when they have flashbacks and stuff like that, that they'll hear things. They're like reliving the call. That's a big part of our job, is the sensory input that we get. You have to deal with this stuff, guys. This isn't just your brain going through stuff. This is your nose, your ears, your touch, you know, your eyes. All of these senses are experiencing things. You have to work through it, whether it feels like it or not. Okay, acknowledging that it's multifaceted is very important. If you encounter one of these, you know, like, or when I say encounter, I guess if you're experiencing any of these where you're like, it's the unpredictability of EMS is making it difficult to focus, or maybe it's like your schedule is making it difficult, the calls that you're running, anything like that, you're gonna have to create your own stress management system. Whatever that looks like for you, you have to make it for you, because it doesn't matter if it's not for you. I can tell you to go work out, but if you don't work out, does that help you? No. So what works for you, and is it healthy? Okay. This is interesting to me. Acute stress reactions is what we're experiencing on the call. The delayed stress reaction is how you feel the next day. Adrenaline hangovers, if you've ever heard of that, it's a very real thing. And then the cumulative stress is in 6 months when you're still thinking about that call. And usually what happens is alarm fatigue, where you can't cope with it, is in here. And that's because you're going back on shift. So please, 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 like I said, maintain that care for yourself, because this right here, what people experience when they're super stressed, is awful. The GI upset is very real, the mental fog, the irritability, insomnia, hyperactivity, potential for drug abuse, all that stuff is very high. Oh, I already talked about that. So critical incident stress, when we talk about this, we're talking about your debriefs. I love a good debrief or a round table. If you've heard of that before, the police are particularly good about that here locally. If there's a really rough call, we try to get the crews together so that we can talk about it. And it's not necessarily just a, hey, how do you feel? It's a, hey, sorry, your name? Daniel. Hey, Daniel, I don't like how that situation went. Can you please explain to me why you did that on that call? That's the point, right? Because questions are usually what breeds trauma. Why did this happen? How did this happen? Is it going to happen again, right? It's just questions, so you can actually address a lot of them. I very much appreciate that because it helps eliminate this PTSD cycle. And the PTSD cycle does require that you get some of that recovery phase before you go to another event that with the potential for that exposure, right? You need to be getting this figured out within like a day or two is usually what they tell people. It's not like you need to, as if you don't, it's never gonna get better, but that's the most optimal time for you to. So if I ran a stressful call, like for example, I ran a really rough pediatric call when I first started at the county. I got sent home from the shift because my supervisor thought it was best. It was a horrible call, like awful. I won't share it right now, but I'll talk about it later. He sent me home and then they mandated I go to counseling the next day. So I had to go, they paid me to go, they paid for the counselor had to approve me to go back to work, which wasn't hard, right? Because it was like, hey, how are you doing? Let's talk about it. And we worked through it and it was fine. But that usually happens within 1 or 2 days of the call. And that's a great resource. Please utilize it if that's an option for you, especially if your department's paying for it, right? And you're getting paid for it. That's the best way to take care of yourself, right? Is to utilize when other people are giving you resources to do so. Usually you're gonna have a counselor for that, like I said, but sometimes they'll do it with like just the people that were on the call. You guys already know what burnout is. You know what compassion fatigue is, right? Compassion fatigue is what a lot of us just feel in our day-to-day anyways because we're tired. People are mean, they're exhausting. That's just the nature of it, that's okay. However, it's not okay if you let that compassion fatigue affect the way you treat patients, right? That's not okay. So I'm sure you guys have heard of this. We are already at a significant risk for suicide. That's just a part of it, unfortunately. We're trying to get better at mental health services, and we are, but that's the nature of the job. Do you guys know the job with the highest incidence of suicide? That's what I thought, but it's dentists. It was a study that I read from a while ago. I imagine it might not have changed. It might have changed. I wouldn't be surprised either way. But there are a lot of stressful areas in different jobs that you probably aren't aware of. Ours are just kind of out there in the open for people, right? People know we go through a lot of stuff. And that's honestly what kind of makes it a little more difficult is because we have to remain calm, even though like if we were to freak out, it would probably be kind of reasonable. You're seeing something really awful. That's the thing that screwed me over the most. Because if I'm going to put on a blank face, I'm going to have to maintain that inside for a steady period of time. Otherwise, it's not going to work, right? So that blank feeling empty feeling is a big problem. And we've already talked about this. I'm not going to go too much into workplace issues other than there are people for you to talk to. HR is not your friend. HR, but I mean, that's big sister, again, like big kid advice as well. HR is intended to be your friend, but they're not intended to be there only for you. They're also intended to be there for the employer. I'm only saying that again because you need to hear it. Nobody told me that. Obviously, they're there for that reason, but you know, like take care of yourself and make sure that you're documenting anything that needs to be documented, okay? If you encounter anything where you're like, this could turn into something, write things down. Write things down, who you talked to, what day it was, all that kind of stuff, because when it comes to these issues, it could fall on you as a partner. In some cases, if someone gets hurt, okay? Substance abuse is a little different. We usually have drug testing to kind of help alleviate some of that, but if someone fails a drug test, they fail a drug test. That is your responsibility to take care of, okay? So that is...